Hi, my name's Joseph Beck. I am the Executive Medical Director of Behavioral Health at UC Ingles. And today we're going to talk a bit about the behavioral health, psychiatric, psychological impacts of living in the time of the COVID-19 pandemic. Yes, so not many more than I would for the general population. It's just whether they can follow it. What is the severity of their symptomology? So most folks who suffer from chronic mental illness, who are already well ensconced in their treatment paradigm, should be reaching out to make sure it's in place and increasing the monitoring. I know just personally as a provider with my own cadre of patients, that's what's occurring, and it makes a lot of sense. Our visits are different. They're virtual. They're significantly shorter. But the contact and the knowledge that there is access goes a long way. And in fact, I don't need to make a lot of regimen changes if I can just let people know that I'm there. So that first, people that are not linked to care or suffering acutely, essentially in just our system, our services are all available. We can assess new patients and triage them to rapid treatment. So the stigma against mental health is one of the things that I'm hoping will really be eroded from our communal experience in this crisis. Having such an overwhelming stress affect the entire population should engender an understanding of what it's like to experience a personal crisis. But that won't help us in the immediate. So there may be still some bias. So I appeal to you to attempt to overcome that on a personal level and reach out. I wonder, and it'll be interesting to see that having all these virtual technologies, whether it'll be easier for people to access or harder in their perception, but I can say that it is there and available. First is the change in structure, and depending on the child's ability to adhere to an internal structure, they may do better or worse, both academically and in the home. The other is the social isolation and the new interpersonal roles between family members who are now positioned at home, but still having full work schedules, and often tasked with teaching responsibilities that would otherwise be ascribed to others who have the clear teaching role. So there's a lot of changes afoot there. So the potential impact is very great. The change in structure alone, which is what many people who are in active recovery utilize to keep themselves sober, could impact relapse risk. Also, initially there was a difficulty with accessing 12-step groups because many of the places they were held were no longer having groups secondary to social distancing. So that seems to have been remedied. So if you are struggling and you have not looked again, you will likely have a virtual group that you can attend, and that will be very helpful. The problem really is that for many in addiction, one of the reasons that they propagated their use was their drug of choice was soothing. People are looking for things that soothe them in this time, which can be so anxiety-provoking, overwhelming. So craving may be very high. I do suggest that people who are in treatment with specialty providers of addiction medicine reach out prophylactically to discuss options, as they do exist pharmacologically and otherwise, to combat increased craving at this time. There will be an incidence of new dependence to substances post this. There's no question of that. So if you find yourself in this category or have questions about whether you are or not, please reach out to Organized Resources for an assessment and evaluation.